Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad SAMIR bin Abdul HALEEM, Year 1 medical student. Today, I will be presenting about the human heart. So, in this presentation, I will be covering about the anatomy, physiology, and disease inside of the heart. So, first of all, let's go through the anatomy of the human heart. The pericardium is a double-walled sac encasing the heart, providing protection and anchoring it to the surrounding structures. It contains pericardial fluid, which reduces friction during heartbeats, essential for maintaining heart health. There are two layers of the pericardial sac, which are the external layer, fibrous pericardium, and the internal layer, serous pericardium. So as you can see in this picture over here, the grey part over here indicates the fibrous pericardium, and the blue part here shows the serous pericardium. And the serous pericardium can be divided into two, which is the parietal layer of the serous pericardium, the pericardial cavity, and also the visceral layer of the serous pericardium. Now, let us look at the layers of the heart. The heart consists of three main layers: the epicardium, which is the outer layer, myocardium, the muscular middle layer, and the endocardium, the inner layer. Epicardium is thin layer connective tissue, contain adipose tissue, nerve and coronary artery and vein. Myocardium is responsible for pumping action of heart and composed of cardiac muscle tissue. Endocardium composed of cardiac muscle tissue and provides smooth lining for chambers and valves of the heart. Each layer plays a crucial role in heart function, from protection to muscular contraction. As you can see, this is the epicardium and this is the myocardium, and also this is the endocardium, which is the inner layer. The next, we will look at the heart chambers. The heart contains four chambers, which is the two atria and also the two ventricles. The right atrium receives the deoxygenated blood from the body, while the left atrium collects oxygenated blood from the lungs, facilitating efficient blood circulation. So as you can see in this picture, this is the right atrium, and then you have below it you have the right ventricle, and you have the left atrium and also the left ventricle. Alright. The next, we will look at the heart valves. The heart has four vital valves: the tricuspid, pulmonary, mitral, and aortic valve. This valve ensure the unidirectional blood flow, preventing backflow, crucial for maintaining effective circulation and also the heart function. So as you can see in this picture, we have the mitral valve, which is also called the bicuspid valve, which separates the left atrium and also the left ventricle. Then you have this tricuspid valve over here, which separates the right atrium and also right ventricle, and this pulmonary valve, where deoxygenated blood enters the pulmonary trunk, and behind the pulmonary trunk here, there is aortic valve. The next, we will be looking at the physiology of the human heart. First is about the cardiac cycle. The cardiac cycle is the rhythmic sequence of events in the heart involving systole, contraction, and diastole, relaxation, of the atria and ventricles, facilitating blood circulation through the pulmonary vein and systemic circuits. Three phases, which are atrial and ventricular diastole, which takes about 0.4 seconds, atrial systole and ventricular diastole 0.1 seconds, ventricular systole and atrial diastole 0.3 seconds, and ventricular diastole. The next, we will be looking at the heart sounds. There are two major sounds from the heartbeat, described as the lap and dap sound, which originates from the blood turbulence generated when the valves of the heart closes. During each cardiac cycle, there will be four sounds produced, but only the first and second sounds, which are called the S1 and S2, are loud enough to be heard by using stethoscope. So the lap sound is produced when the tricuspid and mitral valve closes, and the dap sound is produced when the pulmonary valves close. The next, we will be looking at the cardiac conduction system. The cardiac conduction system consists of a specialized cell that generate and transmit electrical impulses, regulating the heart's rhythm. Key components include the sinoatrial node, atrioventricular node, bundle of His, and Purkinje fibers, which coordinate contractions for effective blood pumping. So this impulse will flow from the sinoatrial node to the atrioventricular node to the bundle of His, to the bundle branches, then to the Purkinje fibers, and then finally to the base of the ventricles. The next we will be looking at the biochemistry of the heart. First is about the energy production. The heart relies primarily on aerobic metabolism to generate ATP, utilizing fatty acids and glucose as key substrates. Mitochondrial efficiency is critical as energy demand increases significantly during physical activity, making the heart reliant on a consistent oxygen supply. The next we will be looking at the electrolyte balance. Electrolytes such as sodium, potassium, and calcium are vital for maintaining the cardiac rhythm and function. Disturbances in electrolyte levels can lead to arrhythmias and impact overall heart health. Hormonal regulation. Hormones such as epinephrine and non-epinephrine enhances the heart rate and force of contraction, while others like atrial natriuretic peptide modulate blood volume and pressure. Hormonal balance is essential for optimal cardiovascular performance. The next we will be looking at heart disease. The most famous heart disease is myocardial infarction. Myocardial infarction, commonly known as the heart attack, is a complete obstruction to blood flow in the coronary artery. The meaning of infarction is the death of an area of tissue because of the interrupted blood supply. So as you can see in this picture, how the plaque buildup in the artery causes it to be obstructed. The sign and symptoms. There will be intense pain in the middle of the chest, described as choking, constricting, squeezing, or tightness. The pain usually spread to the left side of the chest, shoulder, and arm of that side. Occasionally, it can spread to upper abdomen or lower jaw. The patient may be short of breath and perspiring heavily. The risk factor of myocardial infarction. The three most common risk factors for myocardial infarction are hypertension, smoking, and diabetes mellitus. Hypertension or high blood pressure is a significant contributor as it can damage blood vessels and accelerate atherosclerosis, increasing the risk of heart attacks. Smoking is another critical factor as it not only damages the lining of blood vessels but also promotes plaque buildup in the arteries. Lastly, diabetes mellitus, particularly type 2 diabetes, poses a substantial risk because it leads to increased blood sugar levels that can damage blood vessels and nerves controlling the heart, making individuals more susceptible to heart disease and myocardial infarction. So these are the prevention strategies for myocardial infarction, which is adopting a healthy diet rich in fruits, vegetables, whole grains, and lean proteins while limiting saturated fats and sugars are essential. Engaging in regular physical activity, aiming for at least 150 minutes of moderate exercise per week, helps maintain a healthy weight and improve cardiovascular health. Additionally, quitting smoking is crucial as it significantly reduces the risk of heart disease. Together, the changes can greatly enhance the heart health and lower the risk of myocardial infarction. The treatment for myocardial infarction is one of them is coronary angioplasty. Coronary angioplasty or percutaneous coronary intervention is a minimally invasive procedure that involves inserting a catheter with a balloon into a blocked coronary artery to widen it, often followed by placing a stent to keep it open. The second way of treatment of myocardial infarction is coronary artery bypass graft, or we call it CABG. Coronary artery bypass grafting is a surgical procedure that creates an alternative route for blood flow using a healthy blood vessel from another part of the body to bypass the blocked coronary arteries, restoring blood supply to the heart. Finally, we will be looking at the specialization. Cardiologist. A cardiologist is a medical doctor who specializes in diagnosing, treating, and preventing conditions related to the heart and blood vessels, collectively known as the cardiovascular system. They handle a range of issues, including heart attacks, arrhythmias, heart valve diseases, and hypertension. Cardiologists perform diagnostic tests such as the electrocardiograms, EKGs, echocardiograms, and stress tests to assess heart health. They can prescribe medication, recommended lifestyle, and perform certain procedures like cardiac catheterization. Finally, a notable cardiology specialist that I admire is Dr. Michael DeBakey. A pioneer in cardiovascular surgery, he performed over 60,000 surgeries during his career and was instrumental in developing techniques that revolutionized heart surgery, including coronary artery bypass grafting and the use of the heart-lung machine. Dr. DeBakey's innovations, such as creating plastic tubing to prevent strokes and vascular restoration, significantly advanced surgical practices and improved outcomes for patients with heart disease. His contributions have had a long-lasting impact on the field of cardiology and cardiac surgery globally. That's all from me. Thank you.